Hi, we are going to share about anemia. Anemia patients will have limitations on what they do. The signs and symptoms that I'm going to talk or share is what anemia patient will suffer from. The signs and symptoms of anemia might include fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness, chest pain, cold hands and feet, and also many others. In this video, we can see the example of the symptoms that can be shown in anemia patients, which is shortness of breath, weakness, and fatigue during exercising.
Red blood cells are commonly known as erythrocytes. It is a biconcave disc in shape with a diameter of 7 to 8 microns. In normal red blood cells, there is a central pillar that is about 1/3 the cell's diameter. Erythrocytes, we know that it is a red in color. However, their color will change depends on the condition of hemoglobin. Red blood cells are essential for delivering oxygen to our body tissue. The tissues will release carbon dioxide as oxygen is converted into energy. Carbon dioxide is also transported into our lungs by the red blood cells when we are exhaled. So, as we know, there is a few factors that affecting erythropoiesis. First, tissue oxygenation, which is the most important regulator of erythropoiesis. Next, vitamins such as vitamins B12, folic acid, vitamin C, riboflavin, and pantothenic acid. Other factors is minerals, for example, iron, copper, cobalt, nickel, and manganese. Proteins also one of the factors. And the last factors, hormones, which are testosterone, growth hormone, thyroid hormone, cortisol, and adrenocorticotropic hormone.
The causes of iron deficiency anemia may be due to an increase in iron requirement when the person is having blood loss and inadequate iron supply. This happens when the person consumes less dietary iron and impaired iron absorption. Next is a decrease in iron absorption. The absorption is decreased by dietary deprivation due to the undernutrition or iron malabsorption. Let's talk about the mechanism of the IDA and its pathophysiology. People tend to get anemia when their ferritin level is low, the bone marrow iron is absent, and their blood serum is low or high. This will end up resulting in anemia. In this case, a man should have 3.5 grams of total body iron if he is healthy. However, his iron level is below the normal range due to the disease. Iron deficiency manifests itself in stages. The iron need exceed intake in the first stage, increasing the depletion of bone marrow iron stores. To compensate for the decrease in reserve, dietary iron absorption increases. Deficiency affects RBC synthesis in later phases, resulting in anemia. Severe and long-term iron shortages can cause iron-containing biological enzyme to malfunction. Iron balance depends on adequate intake and absorption. When iron stores are low, hepcidin production is reduced, and ferroportin molecules are expressed on basolateral membrane of the enterocyte. They transfer iron from the cytoplasm of enterocyte to plasma transferrin. Iron is used in hemoglobin synthesis. As the hemoglobin level decreases, it will result in a low oxygen level.
I am Farnda Shaira and I will talk about the investigation, treatment, and management for iron deficiency anemia. Number 1 is CBC, which is also known as the complete blood count. Blood is needed to measure the cells in a human's body. For example, red blood cell, white blood cell, platelet, hemoglobin, and hematocrit. Number 2 is the reticulocyte count. It measures the number of reticulocytes in the blood. It is an immature red blood cells that is younger than the erythrocyte. Number 3 is the peripheral blood film. It is the observation of the morphology of the cell. Lastly, it is the iron study, which is the plasma iron or serum. Treatment and management for IDA. Iron deficiency anemia can be treated by taking iron supplements because by taking iron supplements, it can help replenish the iron stores in our body. Next, I suggest taking vitamin C because it is also one of the source for treating IDA because it helps the body to absorb iron. Lastly, I would recommend taking certain foods that have high contents of iron. This way, it can help increase the iron in our body.